John Macqueen, June 27, 1895 to June 21, 1969, was a doctor and medical administrator working in Palestine during the British Mandate. Staff of Haifa Hospital, circa 1939. Graduate nurses, Haifa Hospital, circa 1939. Dr. Macqueen in Centre. Born in the Black Isle, Scotland, he was educated in Inverness, continuing his studies at Edinburgh University where, in 1914, he received a degree in medicine and surgery. In September 1914, following the outbreak of the First World War, he joined the Royal Field Artillery, serving as a second lieutenant in France and Flanders. He then became a captain in the Royal Army Medical Corps and saw action with the Mesopotamian Expeditionary Force, where he was mentioned twice in dispatches. In September 1919 he joined the Occupied Enemy Territory Administration, OETA, in Palestine, and 9 months later he was appointed Assistant Principal Medical Officer, based in Jerusalem. During the late 1920s, as deputy head of the Palestinian Department of Health, Dr. Macqueen was involved in the establishment of the first infant welfare centers in Jerusalem's Old City and Bethlehem. It was part of a government program to reduce infant mortality, which at that time was 201.27 per 1,000 births. By 1929 there were 27 such centers across the country, mostly funded by non-government bodies. Macqueen complained about the absence of financial support from municipalities, specifically Bethlehem and Beit Jala. At that time the health department, with funding from the Rockefeller Foundation, was active in combating malaria. Trachoma affected more than 60% of the population, with many sufferers being treated by the St. John's Eye Hospital, Jerusalem. Leprosy was disappearing, and there were vaccines for the other infectious diseases found in Palestine, rabies, cholera, and smallpox. In 1930 he was given particular responsibility for the railways and the quarantine of travelers. In 1931 Macqueen was appointed Senior Medical Officer in Haifa and Samaria District, and in 1938 he became director of the new government Haifa Hospital, designed by Eric Mendelsohn. In the summer of 1941, during an outbreak of bubonic plague, he was in charge of the demolition of the several thousand huts and temporary homes in and around Haifa and introduced a program of rat extermination. This campaign was successful, but in 1944 the disease reappeared, killing 11 people in Haifa and spreading up and down Palestine. Center, Dr. John Macqueen, Chief Medical Officer for Haifa. The Department of Health was severely underfunded. In 1936 he attempted to introduce a health insurance scheme to pay for medical care in Arab villages. In 1938 and again in 1945 he put forward similar proposals for funding health care, modeled on the insurance systems used in England. In a report he pointed out that in Jenin, with a population of 50,000, there were 4 doctors, whereas amongst a similar population in Great Britain you would expect to find 25. There was only an asylum in Bethlehem and a section of Acre prison being maintained by the state, a total of around 160 beds. In 1942 there was a critical fall in conditions in privately run mental hospitals in Tel Aviv when the municipality stopped funding them. At the time the High Commissioner, Sir Harold MacMichael, commented that the treatment of the insane in Palestine reflected badly on the government. The 1946 survey of Palestine, prepared for the Anglo-American Committee of Inquiry, commented that government expenditure on health care was low compared to other countries and that medical policy had not been carried out. Provision for control of tuberculosis was still lacking, accommodation for those with mental diseases was still inadequate. There was a shortage of trained midwives and the number of infant welfare centers had only risen to 38.